Hello, my name is Dr. Yaakov Lawrence. I'm a radiation oncologist at the Sheba Medical Center in Israel. And today we're going to talk about radiation-induced cancers. I should point out that this lecture was designed for healthcare professionals, not necessarily oncologists. This is an outline of the lecture. We're going to talk about why the subject is important, give some historical examples, discuss what is cancer, discuss the difference between stochastic and deterministic effects. We're going to ask the question, what about low-dose radiation? Is it actually carcinogenic? We're going to talk about the mechanism of how radiation induces cancers, talk about the issue of radon gas. We're going to talk in the clinical setting about, does radiation therapy induce cancers? We'll talk a little bit about public awareness, and we'll conclude with some unanswered questions. So, I'm recording this lecture in early 2022, and I'm going to give you some quotes from the news. Russia has invaded Ukraine, including the area of Chernobyl, and there's evidence that the Russian soldiers have been digging fairly deeply into the earth around the nuclear reactor, disturbing large quantities of radioactive dust. Exactly what will be the long-term health effects for those soldiers is unclear, but it's possible that at least some of them will suffer from radiation-induced cancers. Some other quotes from the last couple of years, public concern and also scientific concern that the increasing use of CT scans or CAT scans amongst different segments of the population, be it smokers, be it children, will lead to an increased incidence of cancers. And a third perspective, maybe from a long-term perspective the most important, but according to NASA experts, and this was published in a peer-reviewed journal, the risk of cancer caused by exposure to radiation in space is actually the main hindrance to interplanetary travel. A little surprising. I'd have thought there'd be many other reasons which are stopping us doing that. And just interesting to note from that same publication, we can see here that according to their estimations, were one to travel to Mars, one would have a significant risk of radiation-induced cancer death. So some historical examples. So radiation was originally discovered in 1895. Quickly, its importance and use spread throughout the world, and one of the pioneers was Professor Wolfram Fuchs in Chicago, who did a very large number of imaging pictures based upon X-rays. However, unfortunately, he developed cancer at a young age, and even then, and this is a quote from the British Medical Journal in 1907, people suspected that his cancer, I think it was a form of sarcoma, was induced by the continual exposure to X-rays. Likewise, in that same decade, there were reports of skin cancers in radiation workers on their hands where they'd been exposed to X-rays, and reports of leukemia in 5 radiation workers. But perhaps the first and the really most public way that the world heard about the risk of radiation was through the story called the Radium Girls. These were young, I think they were all women, who worked in a number of factories in the United States. A type of paint had been developed which was mixed with radium, and it was found to be fluorescent. It glowed in the dark. Of course, this is a great use for alarm clocks and also instruments on early aircraft. In the 2 black and white pictures, these are true images of the Radium Girls, as they were called, and below is the color picture is a modern reconstruction. These Radium Girls apparently were paid by the quantity of dials they are able to paint, and some of them really earned extremely respectable salaries. I even saw one contemporary newspaper headline pointing out that they were earning, these young girls were earning more than their parents. So the Radium Dial Company at its peak had 3 factories across the United States. Already in 1923, the first dial painter died of a bone sarcoma, and within a year, really quite a large number of women were ill, and already a dozen had died. And actually, even in 1928, Dr. Sabin von Schocki, who actually invented this radium paint, died himself. This really caused a public scandal. We can see here newspaper articles from the time. Subsequently, there's only been quite a lot of scientific work trying to understand the basis of what was going on, and you can see here a dose response curve. On the y-axis is the number of cases, and on the x-axis is an estimate of how much radiation or radioactive radium had been ingested by each woman. And this is the same picture again. So what was going on? So radium is in, if one looks at the periodic table, radium is in the same group as calcium, and hence the ingested radium was being carried to the bone. I'll just mention actually how these women were ingesting the paint. What they were doing was they had these paint brushes, and they would put the paintbrush on their tongue in order to sharpen and produce a very thin line, and so and hence they would ingest the paint. So I think the important point from this lecture point of view is this was internal ingestion of a radionucleotide. The cancer location was determined by isotope metabolism, hence they developed bone tumors. Importantly, this case led to the first example of occupational health legislation in the United States. The scientific work showed there was a dose response. Those who'd been exposed to less than 5 gray did not seem to develop cancers. The second case I want to give is the case of the A-bomb survivors in Hiroshima and Nagasaki. Hiroshima, I think approximately 120,000 people were killed, and in Nagasaki about 70,000 in 1945. So immediately after the bomb, there were a number of committees were created, both on the American side and the Japanese side, and subsequently joint committees to understand what would be the health impact of those who've been exposed to this radiation and had survived. Their most famous study is called the Lifespan Study, or LSS for short, which was a lifelong study of the A-bomb survivors. Included 120,000 Hiroshima residents, of whom approximately 94,000 had been exposed, and 27,000, which for whatever reason were estimated not to have received any radiation exposure. At the time when I saw this, it said in this group there had been 22,000 cancers, and it was estimated that approximately 5 of the cancers were induced by the radiation. Just to mention that these bodies are really rather large. This is recent statistics. It said the Radiation Effects Research Foundation has 30 researchers, 170 support staff with labs in Hiroshima and Nagasaki. So you can really imagine it's really quite an intense academic effort that's been going on for many years and continues to this day. This is perhaps the most important slide of the presentation. You can see on the y-axis the number of cases, the x-axis is the number of years post 1945. You can see within about 6 or 7 years there was a peak of leukemic cases, which subsequently dropped off, and starting at about 8 or 9 years there were an increase in the number of solid tissues, thyroid, breast, lung, etc., which increased and never went down. It was a lifelong increase in cancer incidence. Work has been done to see if there was a dose response effect. Indeed there was. So here on the x-axis you can see the estimated personal radiation dose, and the y-axis there increased risk of ovarian cancer, and it appears to be an approximately linear response. Here we can see some of that same data in tabular form. So looking at the first line, these are patients who received what we would call a pretty low dose of radiation, up to 0.1 gray. This affected, in this cohort, they had 27, almost 28,000 subjects, and they saw amongst these patients almost 4,500 tumors, which was slightly more than they expected, and the attributable risk was 1.8%. Conversely, if you looked at those who had a high dose of radiation, more than 2 gray, there weren't too many of these people around. Presumably many of them had actually died very early on, but those who survived at this point, there were 564 subjects. 185 had developed cancer, which actually was quite a lot more than expected, and amongst this population 61% of those cancers were considered to be radiation induced. These were cancers not anywhere in the body. There were certain areas which were more prominent: the bladder, the breast, the thyroid, the lung, and the colon. So, quite differently from the Radium Girls, this was acute external radiation. There really wasn't much ingestion of any radionucleotide. It was to the whole body, and we have a lifelong increase in risk, and it's a very large cohort, but once again they saw a dose-response effect. The third historical example I want to give is an example from Israel. At the time, or when there was a large immigration to the state in the late 40s and 1950s, there was a worldwide epidemic of tinea capitis, also called ringworm, and the standard treatment at that time was radiation to the skull. You can see here, these are pictures not from Israel, these are actually pictures from Serbia, but nonetheless it seems to be something extremely similar. You can see here the X-ray machine and the young child being irradiated. Subsequently, any hair that was left was cut off manually, and then a zinc cap, a zinc bandage was put on afterwards, which was part of the treatment. It was an effective treatment. However, it was noted a number of years later that there was an increase in brain tumors amongst the children who undergone this treatment. In Israel, the leading investigator of this subject was Dr. Baruch Modan. In one of his papers, he looked at 10,000 children who've been irradiated. He matched them to non-irradiated control groups, one of which was a general population, one was actually siblings of the above. He noted that the average dose that these children had received was 1.5 gray, and he was able to do a dose response curve, both for benign meningiomas and also for more dangerous malignant brain tumors. Subsequent in Israel, there was legislation passed to give these now adults compensation. I have to say there was no medical negligence here. They received what was then the standard of care treatment. In the 1950s, medical treatment, grisulfin, was developed, and hence radiation treatment is and no longer used for this reason. The final historical example I want to give is Chernobyl. As a young child, I remember this very clearly in the news, and here we have the front page of the Times of London from April the 29th, reporting there had been some kind of huge explosion. I clearly remember at the time there was confusion. The Kremlin was denying anything had happened, but it was clear to authorities in the Western world there had been some type of terrible accident in Chernobyl. So today we understand there was an explosion, there was a fire, and there was a release of a large number of isotopes, including cesium, iodine, strontium, etc., which subsequently developed a large plume which spread over much of Eastern and Western Europe. Now, it was a complex event. There were firefighters, so-called liquidators, some of whom received incredibly large doses of external radiation. Some of them, I understand, went onto the reactor roof to quench the fire, and it said some of those who went onto the roof never returned. They simply died of incredibly high dose radiation poisoning. As we mentioned, there was the release of a large number of radionucleotides, as I've mentioned here, cesium, iodine and strontium, and also there was local infection, or the right word is contamination, of the milk, and that was predominantly with radioactive iodine. This is a paper from Nature, approximately 6 years after the accident, and you can see here they clearly state, actually this is in Belarus, that previously they typically see 2 cases of thyroid cancer in children every year, but it went up very sharply in the years immediately after Chernobyl. Now, one of the things they noted was that there was a strong age dependence. Younger kids had a larger chance of developing thyroid cancer. Adults had a very low risk, and we now understand that one of the contributing facts to this was that these children had chronic iron deficiency. You can just imagine their bodies are looking for iodine, especially for the thyroid, and subsequently they are ingesting large quantities of it. It's all sucked up by the thyroid, and unfortunately that iodine was radioactive. So here we can see a graph at the age of exposure and the number of cases, and you really can see that it was children under the age of 8 or 9 who were at highest risk. Once again, there have been dose-response relationships drawn. Various curves here showing different ways of drawing a best fit line, but nonetheless clearly there is some form of linear dose response. This is a much more recent paper looking at the incidence of all different types of cancers from different areas of Ukraine, and you can see here for thyroid there was a much higher incidence in the Kiev area than other areas. However, this is not the case for other cancers, hence it really seems that Chernobyl caused thyroid cancers, but apparently not much else. So what's the take-home point? Well, as I said, this is a complex event from a radiation-induced cancer perspective. It was really the chronic isotope ingestion of iodine that was important. We saw there was a relationship with dose, age, and the fact that the children had iodine deficiency. And perhaps the saddest point of this story is it was actually all avoidable. When I say avoid, I mean even had the accident happened, had the authorities told these children not to drink the milk or drink the food from the surrounding farmland, they would not have developed these cancers. So what's the mechanism of radiation-induced cancer? First of all, from a general point of view, we understand today that cancer is a multi-step process. It's a combination of the build-up of a number of mutations in what we call oncogenes, which drive the cells from behaving nicely and normally to becoming malignant, self-driven, quickly growing tumors. We've gone further, and today for a number of cancer types we can actually put our finger on what the oncogenes are. This is the famous so-called Vogelgram by Bert Vogelstein, where in colon cancer he was able to isolate 4 or 5 genes which were involved. It's thought typically that for most cancers you need 8 or 9 mutations. So if that's, if cancer is a disease of DNA damage or mutations, where does this DNA damage come from? So there are a number of options. Firstly, there can be inherited genetic alterations. famous examples being a mutation in the retinoblastoma gene, or in the BRCA genes 1 and 2. People can also acquire DNA mutations. This can happen just during day-to-day living. As each individual cell burns glucose to make energy, it creates a large number of free radicals, and these can damage the DNA. There can be errors during DNA replication where the daughter copy isn't quite the same as the adult one, and there can be external carcinogens. It could be radiation, as we've just been discussing. That radiation can either be from medical source or from so-called cosmic radiation from outer space. Then could be exposure to chemicals such as in processed meat, smoking, benzene, etc., and also cancer-inducing viruses such as HPV. It's interesting to note that already in the 1920s, that's almost 100 years ago, it was really strongly suspected that the radiation was inducing cancers through their ability to induce genetic mutations, and that's actually how Hermann Müller won the Nobel Prize in 1946. I should point out that that was, of course, long before anybody knew what DNA was. Anyway, so we mentioned earlier that there's stochastic and deterministic effects of radiation. These are important concepts to understand. Deterministic effects of radiation, examples would be skin burns, hair loss, becoming sterile, developing cataracts. These are highly predictable effects of radiation. Their severity increases with dose, and there's a threshold dose. So for instance, with cataracts, we know it starts at approximately half a gray. It's really extremely predictable. If you got a dose to one eye, which caused the cataract, you'd expect precisely the same thing to happen to your second eye. That's a deterministic effect of radiation. There's also what we call a stochastic effect of radiation. These are effects which there's really no relationship between severity and dose. A radiation-induced cancer caused by 1 gray is not going to be worse than a radiation-induced cancer by 0.5 gray, but there is an increase in probability. So people get exposed to higher doses of radiation have got a higher chance of developing cancers. Those cancers will not be more severe, but they do have a higher likelihood. Generally speaking, in stochastic models, there's no threshold dose. There's no dose below which it doesn't happen. Any dose can cause it, but again, there's a dose likelihood effect. It's actually unpredictable. We don't actually know who is going to develop it. At this point, I'll just mention again with the Radium Girls, not every worker in that factory, in fact not even the majority, developed cancers. The majority will stay healthy to old age. But there always are some unlucky individuals. So stochastic effects of radiation, we talk in particular about carcinogenesis, which was what we're talking about today, and also hereditary effects of radiation, which I won't be discussing further. This is to see the same, what we just said on a graph. So as I said, with deterministic effects, there's a threshold dose. Low doses don't cause those particular effects such as cataract and skin burn, and then you get to a certain dose and then it seems to level off. Whereas stochastic effects, generally there's some kind of dose response effect. There's no minimal safe dose, and likewise the risk seems to increase and increase. So how actually does it happen on the molecular level? So the classical model that we were taught is what was called the DNA-centric model. Radiation induces DNA double-strand breaks that causes a misrepair and subsequent mutations from the DNA, and if those mutations are in the wrong place, those can cause activation of oncogenes and causing cancer. However, it turns out there are two other mechanisms. The first are very high doses of radiation, when the radiation itself can cause chronic inflammation. So we know that chronic inflammation from whatever cause can cause cancer. Patients who've got long-term foot ulcers develop skin cancer, and so likewise somebody who from typically radiation therapy has developed a long-term complication, an healing wound, that is a place where a inflammation associated radiation cancer could develop. The other mechanism, which is not very well understood, it appears that low doses of radiation can cause genomic instability. And this is sometimes called non-targeted effects. And there's some references I've given here which are really worth investigating. So here in this cartoon, on the left hand side, I've given the classic DNA-centric model. Radiation causes a mutation that's carried on by the daughters, and you can imagine if you have the addition of an extra and another mutation, eventually you develop a cancer. However, with very low dose radiation, you have genomic instability. So after the radiation, it may actually be that there is no mutation, but nonetheless, the DNA of this cell and its daughters is unstable, and subsequently mutations are acquired. It's thought this mechanism of genomic instability is relevant up to approximately half a gray. So, a question which is important, to some extent politically important, is what about low dose radiation? Let's say we had some kind of accident, a large number of people exposed to low dose radiation. Do we have to be concerned about them? So the first thing I want to point out, which makes this whole literature a little difficult, is that cancer is a common disease. The lifetime risk of a man developing cancer is approximately 1 in 2. For a woman, it's approximately 1 in 3. And here we can see that the lifetime risk of cancer really jumps at approximately the age of 60. Just continuing on that same theme about how common cancers are, these are various autopsy studies of people who were healthy and they died of some non-cancer related cause. It wasn't known that they had cancer. In such cases, you can find that approximately 20% of women actually seem to be harboring a breast cancer and prostate cancer in populations at least that don't have PSA screening. For instance, in people in their 70s, 45% of those in Japan were found to have a prostate cancer at the time of death. Thyroid cancer about 10%. So why am I giving you this data? You can imagine, let's say there was some kind of radiation event, a large, let's say 1,000 people exposed to radiation, and there's some kind of decision made that you have to keep these people under very close surveillance. So I'm just saying, reference to the radiation they received, you're going to uncover a large number of cancer cases. The closer the surveillance, the more cancer cases you're going to uncover, because cancer is a common disease, especially amongst those in their middle to late age. So how low a dose is carcinogenic? So this is a dose response curve I showed you earlier, but what if you look at just this corner here where they're very low dose of radiation? So there aren't many data points here. You can draw the lines in different kinds of ways. We don't really know. According to the stochastic model, that actually you would not expect there to be a threshold. Conversely, if you say there's a deterministic model, you would think there's a threshold. I have to say this question I find a little political. Cancer is a common disease. A very low dose of radiation probably does increase your risk of cancer, but only by a very, very small amount, because there's a high risk that we will develop cancer anyway. Why I say it's political? Because I think there is no actually safe dose of radiation. It's all amount of risks and benefits. We have many benefits from radiation exposure, be it for X-rays, be it in various parts of industry, and you somehow have to cope with the fact that you're never going to get to zero risk. Another type of radiation exposure I want to just mention is radon gas. Radon is a daughter nucleotide created by uranium deposits in the ground. The radon can seep into houses, especially into basements, through kind of cracks, etc., as you can see in this diagram. There's also another, I think, surprising method. You see here a picture of a shower. What's a shower doing there? So it turns out that water can also absorb radon gas, and if you have a hot shower, then as the water comes out of the nozzle, it can release the gas. So these are some statistics from the UK, and it's been estimated there that approximately 1,000 cases or 1,000 deaths of lung cancer each year in the United Kingdom are caused by exposure to radon gas. Obviously it's much lower than that caused by smoking, which is considered approximately 30,000, but it's more than other things that we think about a lot, like accidents at work and kids riding bicycles, etc. This is a worldwide perspective. You see the numbers seem to be approximately similar in the United States, Europe and Israel. This is a map of Israel, where I live, and what you can see on this map, I think it's quite an old map, I'm not sure how up to date it is, nonetheless you can see areas of white where there seems to be not much radon, blue where there seems to be a fair amount of radon, red where there are very high areas of radon. The point of this map, and it's the same for every country, is the radon is not equally distributed. There are areas where there's a high risk of or it's known that there is radon in the ground, and areas where there isn't, and you have to act accordingly. So, as I mentioned, I'm a radiation oncologist. I treat patients with radiotherapy. So, how does the treatments we give cause cancer? So I'm going to give you a summary slide, then I'm going to give you one or two examples. So, first of all, we do see that patients develop cancers after we've treated them for their first cancer, but you have to understand more than 90% of those cancers have nothing to do with their treatment. Just that cancer is a common disease, and the same way you can get it once, you can get it twice. It seems in general the risk of developing a radiation-induced cancer from your radiation therapy is approximately 0.5%. Generally speaking, the benefit is in vast excess of the risk. Our priority is to cure the first cancer, and that's the way we view things. There is a dose-response effect. Leukemia can happen in the first 10 years, and after that there can be solid tissues, and that risk is lifelong. And there does seem to be a cumulative effect, increased risk with chemotherapy, whereas both chemotherapy and radiation can together create more secondary cancers than would be expected. I'll just mention there are two populations at very high risk from radiation-induced cancers. Those are children who especially have a tendency to develop breast, bone, thyroid, brain and connective tissue cancers, and also adolescents with breast tissue, adolescent girls whose breasts are exposed to radiation, starting approximately age 9, are at very high risk of subsequently developing breast cancer. So this is a paper from David Brenner. He looked at 120,000 patients. Some underwent radical prostatectomy for prostate cancer, some underwent radiation therapy, and he did show that there was an increased risk of secondary cancers amongst those who'd received the radiation. So you can see here, for instance, of 17,000 patients more than 5 years after diagnosis, there were estimated to be 139 radiation-induced cancers, which translates to approximately 1 per 125 patients. Just to go back, where were these cancers? Bladder, rectum, colon, also surprisingly lung. That's presumably due to scatter radiation. Looking at breast cancer, comparing women who underwent lumpectomy and radiation compared to mastectomy, there does once again seem to be a small increase in the numbers of cancers. You can see here they've estimated the increasing risk over time. Subsequently, that same group looked at a different data set, and they looked at individual dosimetry in these women, and they were able to actually show a dose response. It appeared the median time to lung cancer was 12 years. There was a linear dose response, and amongst women who smoke, the risk of having a radiation-induced cancer was much higher, showing there's some synergistic relationship between exposure to radiation and exposure to tobacco. I'll just point out that there have been efforts, this is a publication by the International Atomic Energy Agency, of estimating the probability of having a cancer from occupational radiation exposure based on the organ dose and time from the event. Another interesting calculator found online, this is not for radiotherapy and not for accidents, but this is from people who are undergoing diagnostic x-rays. You can type in baseline data, for instance, how old, a gender, a number of scans, the type of x-ray performed, and you'll estimate what dose of radiation you received, and what's your additional cancer risk, what is your baseline cancer risk, and it kind of tries to put things in perspective. And then it also, in terms of perspective, also says, well, this is the chance of that CT scan when you say cancer, and that's compared to your risk of dying in a motor vehicle accident, drowning, etc., etc. A very old but nonetheless extremely interesting publication looking at perceptions of risks and comparing what the public think and what expert thinks. So for instance here it said, well, talking about irradiating food, a way of preserving it, experts think this is really a low risk, safe thing to do, but the public thinks it's very frightening. But then you have conversely with radio exposure, the public doesn't really understand this, they don't know much about it, they're not really concerned, but the experts really think this is really a matter of fairly grave concern. So we know the public knowledge of radiation is limited. We know that there's a subject called radiophobia, people are afraid of radiation, and sometimes people don't act rationally. What's dangerous they think is safe, and what's safe they think is dangerous. Interesting, I found this interesting document online with suggestions about how to speak to the public about radiation and radiation risk. And this is another tool I found online about trying to explain to people very small risks. You have, this is the risk of, having an arm X-ray, and you have to understand that the risk of this compared to, driving a car is minuscule. Trying to explain risks to the general population. So to conclude, radiation and cancers are a real risk, but it is rare. The exceptions being children, adolescents, and young women with breast cancer. There does appear to be a dose response effect. The effect of radiation-induced solid tissues takes at least 10 years. Leukemias do appear a bit earlier, but the effect is lifelong. We discussed the difference between external radiation and the ingestion of radioactive substances, in which case certain organs would be more prone. In fact, even for external radiation, for some reasons which are poorly understood, some organs such as the lung and the colon and bladder seem to be more at risk of developing cancers. For low doses of radiation, the effect appears to be more or less negligible, and one has to remember that unfortunately cancer is a common disease, even amongst those who've had no radiation exposure whatsoever. There are some unanswered questions. Why is there a long latent period between radiation exposure and developing cancers? What exactly is the risk of low-dose radiation? Why some tissues are more risky than others? And what's the best way to talk to the public about these risks, and what is their understanding? In terms of further reading, these are the two classic textbooks that I made reference to in preparing this lecture. There's also many papers on PubMed. I'd also point you to the websites of the IAEA and other international bodies which have much useful information. Also, throughout this lecture, on the slides, I gave references to key manuscripts. These are my contact details. Thank you very much.